Hello and welcome to the Chamber Talk Show this afternoon. A lot of people fear going under the knife, but we have a doctor here who's going to talk to us about it today. Stay tuned. We got a great show.
Hi, we want to welcome Dr. Jared Healy to the show. He's filling in for my homie, Dr. Taj. So today we are going to talk about who's going under, like getting put to sleep. Dr. Jared is a anesthesiologist, and that's what he does on an everyday basis. He puts you to sleep. So we're going to go straight to Dr. Jared. How are you doing today? Welcome to the show.
Thank you. Thank you for having me. Doing very well.
Okay.
Going to always tell people that going to sleep is just only part of our job. We always wake you up at the other end. So it's two sides to it.
Okay.
Where did the fear come from? I guess if you think about going under the unknown, the majority of people, I did a little bit of research. I'm Dr. Tamika, by the way. Of course, you were introduced by Dr. April. This is our show. We talk about all things mental health. But today, I know that there is a stigma associated with going under the knife and getting anesthesia. You're an anesthesiologist. Talk to us about that experience for most people.
It's interesting. I see people kind of run the whole spectrum of anxiety levels about having anesthesia, and you think about it, it's a level of loss of control that a lot of people are just not used to. And I think the people that engage with that are the most anxious are very powerful people who are used to being in charge and always being in control. And if you can imagine that for that type of person now being in a situation where they have no control, whether it's a necessary surgery, emergency surgery, or even something elective, it's still that level of loss of control, and it comes with a certain amount of anxiety. And our job as anesthesiologists really is not just the technical part of passing gas, as we say sometimes, but it's kind of trying to help relieve patients of their anxiety on the front end before they go to sleep, and just kind of assure them that anesthesia is probably the safest form of medicine there is. It's the one field in medicine where you have a provider one-on-one taking care of you throughout the whole span of your perioperative care. Medicine doctors, for all of the things that they do, they prescribe medications, and you go home and take that medication, and you're waiting to get a result.
Right.
We do anesthesia, and we manage you the whole time through the whole perioperative experience. So it's one-on-one healthcare, almost like no other part of healthcare.
Okay. Well, Dr. Jared, can you tell people that I guess some of the different options that you can have when you go under that people are not necessarily privy to? Like I know when I had surgery, I had terminate reduction, and initially, I was kind of fearful because I was good until they put the mask on top of my face. And so, you have to breathe and do that to initially before you go under. So when I end up having another surgery, I told them, I said, hey, I'm kind of fearful of the mask. Can y'all do something else? So they brought me a handheld. And so I was able to put that in my mouth and hold it myself. So it gave me a level of control, and I can breathe into that and to go to sleep.
That was a great question, because there are so many different types of anesthesia. I mean, everything from just a regional anesthesia. If you're having surgery on your knee, for example, on your foot or toe, we can put just a single leg to sleep, or put just the lower half of your body. If you're having surgery on your shoulder or arm or hand, we can do a regional anesthesia technique where just that extremity is put to sleep. Most people are familiar with just general anesthesia, where you, especially for a turbinate reduction type of surgery, you need general anesthesia. Certain surgeries you have to go all the way off to sleep. Other surgeries you can have varying types of anesthesia. So yeah, it runs the gamut. Everything from putting in a labor epidural for ladies having going through labor. You can do a epidural for somebody having knee surgery or lower extremity surgery. So it's a very broad field, because anesthesia, they describe it as being medicine of the autonomic nervous system. So we can control different parts of your nervous system to put it to sleep, just different parts or the whole nervous system when you go and have general anesthesia.
I
Okay.
love that because Dr. April, were you going to add to that?
No, go ahead.
Okay. Well, I was going to say, and the level of education for something, I mean, a liability of this, and just the thought of somebody having this type of power. I even want to talk a little bit about your education and your background and what led you up to this. And then I'm going to switch it over to Dr. April because I'm pretty sure in her office, she may have counseled someone who was getting ready for surgery and they had that level of anxiety. Because I can imagine that
Mhm.
it's there. And when we start talking about pain management and we start talking about people needing surgery and taking that leap of faith into moving in that direction, because some people are afraid to go under the knife. Let's talk a little bit about your background and what gives you that authority to walk in that hospital and say, I am going to take care of you from start to finish.
I always joke and tell, because I mentor a lot of students and talk about how I was in the 27th grade by the time I finished all of my education. So just kind of putting it in
Here,
perspective for
here.
them, thinking about first through 12th grade and the levels of education that it took. So the training for anesthesia is, it's a little unique because it's highly, it's specialized in just anesthesia. You go through medical school, and while you're in med school, well, after you finish college, go through med school, and during med school, you doing, especially your third and fourth year, you rotate through different disciplines of medicine. You spend time in internal medicine, pediatrics, surgery, psychiatry, everything. So you get to see a little bit of everything, and that's where you're supposed to be focusing or making a decision about what you want to do. I knew from a very young age, before I even went to medical school, that I wanted to be an anesthesiologist. And it was from experience, my personal experience, having a series of surgeries back when I was in the third and fourth grade in elementary school. And the thing that I remembered most about that experience was the anesthesiologist. I had just the worst mouth you can imagine, and come from a single parent home, and it took my mother a lot to be able to afford all the things that she had to do to give me the shiny bright grill that I have right now. Yeah, I had a lot of surgeries. So, but the anxiety about the procedure, it was always the same anesthesiologist. I was going to the same oral surgeon over a period of a couple of years, just to get through this process. But he just made it just so uh, it, he took all of the tension out of having surgery for a young kid who really didn't know anything about going to sleep and what all of that. I knew that I had to have surgery, and so that inspired me. I went through medical school. I went through all of the rotations. I knew that I wanted to be an anesthesiologist. So after you finish medical school for anesthesia, you have to spend a preliminary year doing something, either medicine or surgery. Some people choose to go through surgery because they think, well, you're going to be an anesthesiologist, so you need to know about surgery. I had a different sort of philosophy. I thought that I need to know a lot about medicine because I need to know people's medical problems
Mhm.
so that I can manage their anesthesia and consider those medical issues while they're under anesthesia. And that's the route I took. I spent a year in internal medicine, and then 3 extra clinical years of clinical anesthesia. And when you add it all up, it's just a lot of training and gives you a lot of
Okay.
comfort. And I think it didn't hurt that I trained at what I would argue is one of the best anesthesia training programs at Emory University here in Atlanta, because it's so hands-on. You spend a lot of time at the main Emory Hospital, but you spend a lot of time at Grady Hospital, which is a major level 1 trauma center. You get to see a lot of stuff and get to do a lot of things. And I left that program with the amount of comfort that there's almost no situation I can be in that I don't feel like I can take a patient into the operating room and bring him out to the other side. I've had the sickest of sick patients. I've been practicing anesthesia in some of the places with the least amount of supplies, but I know how to take care of a patient.
Okay.
Awesome.
So Dr. Jared knows what he's doing, y'all.
That's what I was thinking. Okay, I was so comfortable going under the knife with you. And in a second, I actually want you to take us through that process from start to finish. So those of us who don't know much about medicine and what it looks like, I want you to talk to us about that. But I want to switch it over and talk to Dr. April about, have you counseled anyone who had that anxiety before they actually went into a surgical procedure?
Oh, yeah, absolutely. I've counseled people, but also myself, and I feel like the mind is powerful. And I believe the mind is powerful. So it's all about how you train your brain. Initially, before I can speak for myself, was going to have surgery, I went into a meditative state. And so I had a wonderful conversation. My anesthesiologist was great. I was one of the top hospitals here in Dallas, UT Southwestern Medical. So, we were talking. He was like, "You're just so calm. Like, we don't need to give you anything to relax you." And that's another option. They can always give you something to relax you if you are anxious before it's time to go under. But I just went to a place to where, okay, let me calm my mind. Let me meditate. Let me imagine like I'm on a beach. Let me focus on deep breathing. In my head, I was saying affirmations. I'm big on affirmations.
Yes.
So I was saying affirmations to keep myself calm. Like, you can do this. It's going to be okay. Like, you are powerful within yourself. So a lot of times it's self-talk. If you can talk yourself and calm yourself down and get yourself to a state of just peace, you can go through anything and be okay.
Awesome. And I was looking, and I know always, every time we do a show, I begin to do a little bit of research. And I saw where it says fear, of course, brings anxiety, which could impact the surgery, the procedure itself. Walk us through the process, if you can, really quick, Dr. Jarrett, before we close the show. We want to see what that looks like from beginning to end. A patient comes in for surgery.
Yeah, so it's different for different types of surgery. Most of the time, you have a lot of pre-op time from the surgeons in the surgeon offices giving you instructions to. We have in-house anesthesia providers who communicate with our patients ahead of time to talk to them about the plan for surgery, and a lot of times it's really just having some knowledge of what to expect, managing expectations that really takes a lot of fear off the table. People want to know what to expect. So we always make a big deal about just making sure that patients are medically optimized. Everybody, depending on whatever surgery you're having, most people have certain medical conditions that you have to manage and think about ahead of time. So you need to, when we communicate with our patients ahead of time, we know about their asthma, we know about their smoking history, blood pressure, any heart disease, and so we are anticipating how to manage that ahead of time. So we give them a lot of instructions about and give them information about how we're going to manage. And we make a very big deal about not having anything to eat or drink before surgery. And it's certain emergency surgeries where you just had something to eat, and the risk of waiting until this food is passed out of your stomach is a bigger risk than taking you to surgery right then. So again, I'll try not to get too much into the details, but there are just certain things that are important depending on the type of surgery that you have. So you show up on the day of surgery, and we'll reiterate or go over all of the issues, medical problems, or anything that the patient's been taken care of at home or seeing their medical doctor about, and we talk to them about the anesthesia. Almost invariably, we'll give them some anti-anxiety medicine, midazolam, unless unless we're as laid back as Dr. April, and she can just meditate her way through it. But most people require a little midazolam just to kind of relax them, take the edge off before they go back to the operating room. It's an anti-anxiety medicine. It's also an amnesia type medicine. So most people will go to the operating room, and even though they're awake and talking to you, won't even remember going to the operating room because of the medicine, anti-anxiety medicine that we give to them on the front end. If it's a typical general anesthetic, just like you described, Dr. April, you'll breathe some oxygen through a face mask, and everybody's very aware. When I say everybody in the operating room, there's usually only two or three people to start off with. There's a pre-op, a OR nurse, and then the scrub tech who actually helps the surgeon with instruments and things like that during the surgery, the anesthesia provider, and the surgeon too. So it's a small group of people usually in most cases, and everybody is aware that this patient is probably a little nervous. Everybody's usually very quiet and trying to help to add a little bit more calmness, if you would, to the room and to the environment. And then we just kind of walk you through. We just kind of, a lot of times I'll tell patients as I'm giving them the medicine that puts them to sleep, I said, this is the part where you can count backwards from 10, and I'll tell you which number you get to when you wake up. And most people don't make it till 5, and they're already asleep.
Yeah, I can say from experience, and I've been under the knife once before, and I do not remember anything. I said maybe I had the same medicine that you mentioned. Definitely amnesia. Just remember waking up, feeling just really, really groggy, and so on and so forth. So when the patient wakes up, you're there. What happens?
Usually, it's so disorienting. Most people wake up fairly confused, and it's funny. Most people wake up and want to know. They'll be in the recovery room for 20 minutes and want to know, well, when are we getting started with this? When is surgery? So it's so for for the first 10 to 20 minutes afterwards, most people are just sometimes sort of combative because they're disoriented and just trying to figure out what's going on. And some people will just wake up with just kind of like a calmness, so it's hard to predict, but everybody's always anticipating, trying to see, okay, how is this going to be? And we go through a lot of safety measures between having the side rails up on the stretcher and having padding just to kind of anticipate how this particular patient will wake up. It's interesting because young kids, up until about the age of 21, 22, from teenage, absolutely young elementary age kids up to about 20, 21, almost invariably wake up very excited, just really wow, sometimes even combative. And so you have to get them through that excitatory phase of after the anesthesia and amnesia. But older patients, like I said, usually get over 25, they wake up with a different level of calmness and relaxation.
Now, is there a reason why some people take longer to wake up than others? I know for me, it took a while for me to wake up. The surgery was done and I was still out for probably 2 hours.
Yeah, it's a combination of things. And really just it's a thing, it's tolerance to the medication. Sometimes people are naive to, when I say naive, they've not taken a lot of pain medicines or narcotics for whatever reason.
Yeah.
And so the typical medication that we would give to somebody having a general anesthetic, maybe it was, and we're titrating medications to effect, meaning we're looking at your heart rate and your blood pressure, and we're trying to manage and even based on your body weight, but sometimes that medication just lasts a little longer with some people than it does with others.
Okay.
Okay. Well, that's awesome. Both of you have kind of explained, talked about the anxiety in the process. And as we kind of draw to a close, and I'll let you both give closing words, I think it's safe to say that people more wake up more than they don't. When I was looking at it, it's very rare that people don't come back from the procedure or the anesthesia. So Just kind of let's as we bring it to a close, and of course we'll go to Dr. April in the end so that she can give an affirmation. But anxiety is normal when it comes to things like this.
That's absolutely true, and you're right. Most people, like I stated earlier, anesthesia is the safest form of medicine that you can have because it's rare where a provider is sitting and taking care of one patient throughout their whole healthcare process, and anesthesia is unique in that regard. Uh, if you practice anesthesia long enough, there are situations in most of my experience where I've actually lost a patient. They were in trauma situations of patients that were so critically ill that just bringing them to the operating room was just a sort of a last ditch sort of heroic effort to start off with. Typical run of the mill healthy patients, even patients with medical conditions that are managed, 99.999% of those patients go through surgery without a single hitch. And it's the safest thing that you can have happen to you in healthcare.
Perfect. And Dr. April, I love the fact that you use your mind to get you prepared for this procedure. You positive self-talk, positive affirmations. We always end our shows on positive affirmations. So what could you say to someone out there who is contemplating moving forward and going forward with a procedure that they really need to help them manage their lives, pain, whatever it is that they're going through? What could you say?
Well, I can say the benefit of whatever it is that you have to do the procedure outweighs the negative of it, because at the end of the day you're going to come out of this and you're going to be better for whatever it is that you have. So I would say that you are a powerful being. We are powerful beings. We can conquer anything that life throws our way. You just have to put your mind to it.
Awesome. I love it. I love it. Thank you, Dr. Jared Huey, for coming on, taking time out of your Sunday to join us for it. We are a mental health show, all things mental health that we talk about, from relationships to pain management. So, whatever it is. So, definitely go out to YouTube and watch some of our shows. We have over 200 videos out there. I think you guys would enjoy those. And we're going to end on a positive affirmation with Dr. April.
Hey, I can overcome anything that life throws my way. I just have to focus my mind on overcoming it.
I love it. I love it. Thank you guys for joining us as well. Thank you, Dr. Jared.